My name is Dr. Abdelrahman Salem. I'm a doctor of physical therapy from Brooklyn, New York. Today with the case in my clinic, I have my brother here. I'm thankful for him. He doesn't mind me filming. He doesn't mind his face coming as well. Okay guys, my brother, he came in with look at this. He has been all the side, the right side of the face, of the cranium, of the neck, of the upper shoulder, of the whole arm. Okay guys, honestly for the cranial pain, gonna take some time. I wanna work on the cranial as well. I do cranial, and if anybody wanna learn the cranial, I'm gonna teach cranial very well. If you guys wanna learn cranial, just stay tuned. I'm gonna teach you cranial to the core, to the bottom of it. Okay, now for this case here, it's a case of radiculopathy mainly. He has a case treated as cervical radiculopathy. The pain in the neck can radiate up to the head, can radiate to the ear, can radiate down to the arm. So I'm gonna show you today how we're gonna do neural mobilization, how I do it myself, okay? Okay, first of all, if the pain in this side, number one step, I'm gonna be seated in the other side of the pain. I'm gonna put my fingers in a contralateral side of the cervical spine. Imagine here, if this is the head, this is cervical spine, I go put my hand on the other side. This is the first step to treat cervical radiculopathy with positive neural tension tests for any of the four major nerves in the arm: median, ulnar, radial, auxiliary. Okay, this is the spine, cervical spine. Okay, if the patient has a right side radiculopathy, positive neural tension test is on the right side, right arm and shoulder. I'm gonna put my fingers here, okay? But I'm gonna be seated in a contralateral side. And I'm gonna move like this. See, I'm gonna move the spine like that. Okay, and all the neural mobilization should be painless. If there's pain, I mean we're doing too much, the nerve is already irritable. So we need to never irritate the nerve. Okay, now see here, it's painful, my brother? No, it's not painful. So I'm doing the right thing. I do this 30 repetitions. Just to move my fingers here. Just moving the spine, mobilizing the spine. This is number one. After I finish 30 repetitions here, I work with my brother. I'm gonna turn here. Okay, do you see my hands? This will be here. Give me the baby. Okay, if this is the head, this is my hand here in the thoracic spine. I put it even on T1. This is, my hand is like that on T1. And I move my hand like this, like this, like this. Okay, my hand will be moving this way, guys, this way. I'm gonna start in T1, very deep, and I'm gonna do this movement, very simple. Guys, be sure your forearms are rested on the table. Be sure you're sitting comfortably. Be sure your 2 feet on the floor. Be sure your knees and hips are 90 degrees. Keeping the right distance between you and your patients. Don't bend over too much. Don't extend too much. This is good heat. Now I'm gonna put my hand just on T1, and I'm gonna just roll my hands like this. You see, guys? Like this. It's very kind traction. Very gentle traction, and at the same time it's like massaging. I'm stretching the soft tissue. It's like my facial release, like massaging the soft tissue, and at the same time it's gentle traction to the soft tissue and cervical spine as well. Do this. You see this, guys? This movement. I do this also 30 repetitions. You count 30 times. Then after that, the same. I'm gonna do the number 3 with the number 2. You put the fingers like this and you move the soft tissue like that. You stretch the soft tissue. The occiput will be here in a hypothenar, and you do this. You rub it like that. If I take the skeleton, very gentle with this young one here my hand, and I do this. I do this. I keep hand here stable, and I do this. And I do this 30 times. This number 3. Stick on the tip of my fingers here. Rest, my brother. Relax, my brother. Fully relax. Thank you for accepting to film. Relax, my brother. Be rested, please. under my fingers is actually massaging. Patient love these two techniques, the number 2, number 3, because it feels soothing and comfortable. Then I'm going to do here, stretching the tissues. See? Traction of the tissues with my fingers. Here, here, here. Start T1 and go up to the accept. Stretch a little bit, gentle traction. After you finish the 30 repetitions, okay, you have to be sure that you stretch the tissues in your hand. You do traction. You traction the tissues first, and keep holding the head from the accept while keeping the traction. And I'm going to do this. Look at me here, guys. 1, 2. I move 3, 4. Passes. Here, I increase the range. If it's no pain, I increase the range a little better. I keep the traction. If I lose the traction of the tissues, I start again. Start from down like this and pull. Start again. And okay, do the traction of soft tissues. Come to the head to accept and move again. 1, 2, 3, 4, 5, 6, 7, 8. Okay, if the patient has radiculopathy or numbness in the right side, while my traction here, I do the traction here, I take a little bit of flexion and I go on the other side. In this position, I ask the patient, how is the pain? Usually the pain and numbness is much less with the traction, and you pull it away. Why? Because you're opening the nerve foramina, the nerve foramens, and you're opening, and with the nerve exiting, with the nerve exit, you're widening this foramens, and the compression on the nerve root and the rotation is less. The patient feel much better. Okay, the goal of this is not the traction, it's a neural mobilization. If you need the traction, I'm going to show you in another video how I do the traction with my patients. Love it. Very simple, very easy. I'm going to show you the traction, but my goal here is the neural mobilization. Okay, this number, if I lose the traction, start again. I'm going to do 30 times. Okay, by the way, I'm going to show you the traction if I need to do it. The traction, I'm going to put my forearm here. Start in T1. This is my forearm. Anthony, come from top. Show the camera from the top. My brother, thank you, doesn't mind filming. My brother, yes, he doesn't film fair. Okay, look at my hand here, Anthony, from the top. See my hand, show my hand here down. I keep my forearm here and I just pronate. Start with my forearm supinated. Forearm fully supinated. And I'm going to hook it here and I pronate. When I pronate like this is traction. If I want to make it the perfect way, traction, see, this is my hand. I'm just open the mask for a few seconds. Okay, here under the chin, the thumb is just in the front of the chin. And again, start my right hand. You do use whatever hand you like. Okay, and my hand is supinated and my forearm is supinated. Then I'm going to pronate. While I'm pronating, I do this. This is traction. Okay, what if my brother here has numbness or pain in the in the right hand or elbow or shoulder? I'm going to do this. Look at me. I'm going to move this way. This way, a little bit of flexion. This is you take off the pressure, take the pressure off the nerves that go into the right upper extremity, right shoulder, right elbow, right hand. This way, you're going to take off the pressure. The pain will be much less or eliminated. Keep this intermittent traction. You can repeat it, okay, several times. Again, I start here. This is just a hook. This doesn't nothing. Just hooking here. Just hooking. I'm not pulling. This is the hand, the right arm with the forearm. This one that is really doing the traction. This is the way you do the traction. This is one of the ways actually you do the traction. After that, guys, I'm gonna do the actual neural mobilization where I'm gonna floss the nerve. Okay, guys. Please, if you're watching here, this is my point. Any patient come to you with neck pain, shoulder pain, or hand or arm pain, please, first thing to do is check the radial and ulnar pulse. Why? Try to look for Addison sign. Make sure the Addison sign is negative. Make sure the pulse is there. What if the pulse is not there? If the pulse is not there, this indicates positive Addison sign. And me, Dr. Salem, I graded Addison sign from severe to moderate to mild. and I did this all, not marketing, but I show it in all my DVDs that I published a couple of years ago. They are available, like my office, available everywhere. Just review the number 5 DVD. It shows the grading and how to treat different degrees of Addison sign. Anyway, if I check the pulse, this position, and it's not there, that means has positive Addison sign severe. And the best treatment for Addison sign, and why is it important to check the pulse? Why is it important to check Addison sign? If there's no pulse, the blood supply is compromised. And the blood supply compromised, how are we going to imagine the healing will happen? We need first the blood to go with the nutrients. When the blood goes, blood circulation goes very well. It takes the nutrients, it takes away the waste. Okay, and I want to let you know, guys, here, when a patient have a nerve pain, okay, we cannot palpate the nerve as easy as we do with the arteries. I just want to let you know, guys, the nerve, artery, and vein, they travel together. The main nerve, main artery, they travel together in a neurovascular bundle. And if the artery is compromised, indicates that 100% nerve is being compromised, nerve is being compressed. How I indicate? When I check the pulse, it let me know how is the blood supply for the arm, how I'm going to expect the healing. That's number 1. And I have to fix that first, fix the blood supply first before mobilizing the nerve, because if there's no enough blood supply, that will be difficult to heal. So first, be sure to get enough blood supply. Then when the pulse is not there, it tells me now that the nerve is being compromised. The second point here, my guys, here is the weakest vessel is the Vasa Nervosa. The nerve gets its blood supply from a small artery that travels on the side of the nerve. If there's a nerve, the small artery travels, side of the nerve is called the Vasa Nervosa. First thing, when the nerve get compressed, or the nerve get pressured, the first thing will happen is they're going to block the Vasa Nervosa because it's very weak. Then the nerve has no blood supply, or the blood supply to the nerve itself is being compromised by blocking the Vasa Nervosa. When the blood supply to the nerve is compromised, what's going to happen? The nerve is going to be like dying. This is going to have numbness, you're going to be weakness. An arm, you're going to lose sensation or decrease sensation. You're going to first, when the nerve gets irritated, it gives you a lot of pain, a lot of parathesias, a lot of irritability. But if the nerve actually compromised and compressed, it's going to give the weakness in the muscles and so on. So number 1, we need to be sure that you get blood supply, enough. How am I going to fix the blood supply? Now I'm going to treat this like, hitting 2 birds with 1 stone. Look at this, guys. Here, actually, this is my technique. I use it to, first, I'm going to mobilize the nerve. Mobilize the nerve. At the same time, I'm going to relax the scalene muscle. How I'm going to do this? Look at me here. I'm going to go here. I just feel holding the elbow here, and I'm going to push the shoulder up. When I do it 100% perfect, I'm going to take the head and I take it to my side, extend and side bend, and I do this together. And if you want to do it like that, either you do with the pressure, and if you want to do the pressure the right way, guys, the more techniques the more you can hit 3 or 4 birds by 1 stone. Okay, if you want to compress, it's better to compress in the parietal lobe here, and you press in a way that you're pressing on a C5 and take this out. I'm going to explain this why I do this later. When you press in the parietal lobe towards C5, you're actually relaxing the posterior cerebral artery smooth muscles. These researches were found by Dr. Jamiti. I don't want to move too far, but I'm going to give you later on how to relax the brain arteries, relax the smooth muscles of the brain arteries to help people with cerebral palsy, to help people with stroke. But just I'm going to give you an idea from having patient treating. Why not? I'm going to do this anyway, so why not relaxing your cerebral arteries, increase the blood supply to the brain, make him feel better, okay? This way here, I press here, and do this. Okay, I hold this for 90 seconds. It's actually what I'm doing here. This counter strain technique, if I'm doing for 90 seconds, it's counter strain technique for the right scalene muscle. Why the scalene is important? Why I have to relax the scalene? The scalene is like the deltoid. 3 parts: anterior deltoid, middle deltoid, posterior deltoid. The scalene is like this: anterior scalene, middle scalene, and posterior scalene. Okay, and the neurovascular bundle we spoke about, the nerve, the artery that travel between the anterior scalene and middle scalene. Okay, guys, and with the scalene spasms, it makes like a scissoring to block the neurovascular bundle, compromise the artery, compromise the nerve as well. So when you relax them, you take off the pressure of the nerve and artery, and the pulse comes back. This technique is, when I do this for 90 seconds, it's counter strain for the scalene, okay? And if I'm in a hurry and the patient cannot relax, I can do for 90 seconds, 90 for counter strain. If I do for 9 seconds or 10 seconds, is with the pressure. This is called the positional facilitated release. It's for patients who cannot relax. Now, I'm giving you a lot of information. I know it may be too overwhelming for you, but step by step, if you slow it down and you re-listen, you know, and you're gonna digest it very well. Okay, we spoke about relaxing the scalene to improve the blood supply to the artery, to the limb, to the nerves. I spoke about the scalene compromised, but the neurovascular bundle being compromised between the anterior and middle scalene. But also you have to know that the scalene, what it does, the scalene is accessory respiratory muscles. It's not supposed to work when you're resting and relaxing. It's supposed to work only when you're competing, like running, jogging, swimming, to increase to open the first rib, move with the bucket handle. Scalene attach here to the first rib, move it up, bucket handle, to increase the vertical dimension of the chest, to increase the ventilation and the volume of the air, to match the metabolic demands when people are running or swimming. So the scalene hold the first rib and pull it up during inhalation when competing. Okay, this is for normal. During resting, scalene should be resting, not relaxing, not working. But when people have body tense or spasmed by stress on life, whatever, overthinking, so scalene keeps spasming all the time. So scalene pull the first rib up all the time. Okay, the neurovascular bundle passes between anterior and middle scalene head, but also passes underneath the collarbone here. Neurovascular bundle travel again here. So the neurovascular bundle travel between the clavicle and the first rib. And when the scalene pull the first rib up, it squeezes, compresses the neurovascular bundle between the two bones, the first rib and the collarbone, can make it more difficult. Then there's a way I treat it, I told you before. This technique makes, like, say, 85% of the patient will be resolved with this technique. If it didn't work from the first visit, if it didn't work, I'm going to show another way to do it. It's going to be different lecture, different presentation. Just stay tuned, subscribe to the channel, be sure you get all the news, all the new information. I'm going to show you if it didn't work. 85% of the patient improve with this. We resume the blood supply again. We relax the scalene. Okay, the relax the scalene. Sometimes you relax the scalene, the blood supply improves. You added positive adenosine sign becomes negative. If it didn't, mean the first rib is stuck over there, and I'm going to show you how to depress the first rib, brush down the first rib back in its place. I'm going to show you there's different techniques for this. There's a lot of techniques, 5 different techniques. Anyway, now let's do the neuromobilization back again. This here, look at this. Now I'm mobilizing the scapula. Be sure, guys, when you mobilize this, you're mobilizing the whole scapula. This is first step in the neuromobilization. This, I like it. Okay, I did this from the side here. Please, guys, if your patient has some pain in the scapula or the interscapula region, I ask my patient to either, I can do this way, look at me. When I do this, I'm mobilizing. But this could be, look at the patient. If the patient is so irritable, it's a lot of pain, cannot sleep, don't do this now. Don't do the first visit. You can postpone it. See now here, I'm moving it. See protraction and retraction of the scapula. I'm mobilizing here. Why I'm doing this, I need to mobilize the long thoracic nerve and and the scapular nerves as well. If I want to do the scapular mobilization, I'm going to ask the patient to lie in the left side, and I'm going to hold the scapula, trying to lift them right. Okay, look at this, guys. I'm going to hug this here. I'm going to put this here, stabilize here, and see now I'm going to move this. I can put my knee here, stabilize. Okay, stabilize here, and I move this. See this? Very easy. I'm going to move this. I'm moving the scapula. Mobilize the scapula. I can stabilize here. I can use my knee also to mobilize the thoracic spine. If the patient can take it, I will do it. See this? If the patient cannot take it, I can put a pillow here, and I press my knee on the pillow on the patient. Put pillow between me and the patient, and I move the knee. With this, I'm mobilizing the spine. Put the spine, and I'm stabilizing and moving the scapula. See now, guys? Okay, mobilize the scapula here. Okay, this mobilizing also the long thoracic nerve. Laying your back, my brother, again. Now we'll do the actual neural mobilization. How are we going to do it, guys? I'm going to ask my brother, the arm is mine, head is yours. You're going to keep turning your head right and left all the time. I'm going to start with the shoulder flexion, then shoulder abduction, then the elbow flexion, extension, then the rest. My goal is to floss the nerve. Floss the nerve is glide the nerves. So the nerve actually is very strong. Even after we cook them, you cannot, bite with your teeth because it's very strong. If the nerve is too very strong and you cannot bite with your teeth, if the nerve is being pinched, so if you keep mobilizing the nerve is going to create space for itself. This is what the goal is. When you mobilize the nerve is going to create a space of itself. You're going to widen its place. Let's go do now. When I do this, I want to ask my brother first. This pain is more painful when I do this?
No.
Okay. What about this? This less pain?
Yeah.
This less pain. So when I'm up, I'm gonna match with my patient. Check first which side is less painful. Head away with the flexion. This little from this now. Together. 1, 2. Please do this 30 times. Then I'm gonna do the abduction is the same. You're gonna flexion 30, abduction 30. Then I'm gonna do the elbow. Okay, here, look right, left. 30 times. I'm gonna check. Okay, you're gonna find when you're working, guys, you're gonna find is the nerve improving and no. We'll do each of these 30 repetitions. How are you gonna know the nerve is improving? If there's resistance to the passive movement I'm doing, it means the nerve is so little. If the resistance decreases, means the nerve irritation is less. After you do the elbow 30 times, then you're gonna do the hand. Keep turning your head, my brother. And this is the neural mobilization. I give my patient with some home exercise program to do. Next time I'm going to show you what the home exercise program I give to my neural mobilization patients or positive neural tension test patients. Again, this is Dr. Abdelrahman Salem from Brooklyn, New York, Doctor of Physical Therapy. Thank you for subscribing. Thank you for liking. Thank you for sharing. And see you next time. Stay tuned. You're going to get the best.